Good evening, everyone, and welcome to Queeries. And as you can see, we are continuing on the show to exhibit, good health standards by continuing to wear a mask. Plus, I think it looks really good. Hides wrinkles and stuff like that for me. I'd like to welcome Dr. Aaron Block to the show. This is Dr. Block's first time here. He's a family medicine specialist, and he also sits as a member on the Board of Health for Dayton-Montgomery County. So welcome to the show.
Thank you so much.
You're very welcome. And as you can probably figure out, we're going to be speaking at length with respect to COVID-19, which is pretty much, all the talk of pretty much the world at this point based on the pandemic spread and the impact that it's actually had. So I've already pre-cooked a bunch of questions, so hopefully you don't mind being interrogated, Dr. Block.
Oh, I get interrogated on a daily basis. This is natural.
Awesome. All right, so we'll start right away, I think, with what I consider to be, at least a very important question on my mind. So in terms of misconceptions surrounding COVID-19, and specifically prophylactic measures that people in the general public can actually take, can you discuss some of the misconceptions that are floating out there and kind of debunk some of the weirder theories that are floating around?
Yeah, certainly. One of the most important things that I think we need to re-examine and discuss is the use of bleach, rubbing alcohol, and other disinfectants, and what proper use is and what is something that's dangerous. These chemicals really help destroy viruses and bacteria once they make contact with the cells, and we use them for decontaminating surfaces. So you spray them in your kitchen on your countertops, you spray them on workout equipment, you let it sit for a little while, and then you wipe it away. Mm-hmm. We are not designed, as human beings to actually consume these substances because they are toxic to basically all cells. Mm-hmm. If you think about it, if they kill bacteria and they kill viruses, they're probably going to kill our cells as well. Mm-hmm. So any cleaning substance or disinfectant should never, ever be ingested because it's only going to damage our cells, our good cells, and has the risk of actually destroying some of our organs from functioning normally. Mm-hmm.
We don't want that to happen, for sure. And I think, one sort of quick follow-up question, with respect to the disinfecting quality of, everything from bleach, rubbing alcohol to Lysol and, other said products. I think a lot of people, in terms of going out and buying disinfecting wipes, think that if I just wipe something down quickly, like my counter or whatnot, that actually takes care of, oh, it's all dead now because I wiped it down. In terms of, one of the things you said is that it has to sit there for a while. So if you are in fact using those products to properly clean, not to consume, but to actually clean and disinfect, how long should a product like that be on a hard surface to make sure that it has in fact disinfected, not just sanitized, but disinfected that surface?
Yeah, that's a good question. And what I really encourage is, based on what your cleaning substance is, actually take a look and read the label on the bottle. It's in all that tiny little print, but it actually will tell you the amount of time. Mm-hmm. It usually depends on the concentration of the substance. So, when we use rubbing alcohol on the skin, like before I do an injection, usually need that substance to actually dry, because that's indicating the amount of time that we needed to help disinfect the skin. When you're using bleach, when you're using other products, even something like lactic acid is an acid that's used to help disinfect. If you look at those labels, sometimes you have to wait up to 10 minutes mm-hmm. to really have true disinfection. So if you're spraying, wiping, and then making contact with that surface, you may not be as protected as you think you are.
Mm-hmm. Well, and I think the other thing too, one of the things that has really been, I think, pushed very hard by the medical community is you need to wash your hands. And just in terms of efficacy, washing your hands with soap is the single best means of making sure that you are not infecting yourself or transmitting the virus versus using like a hand sanitizer, correct?
Yes. So there are different mechanisms of action, as we would call it, in terms of how they disinfect. Using hand sanitizer actually is kind of like when we were using the rubbing alcohol, or using a substance that kills all of the bad cells that are sitting on our bodies, so the bad bacteria and the viruses. And honestly, you can only use hand sanitizer about 5 times in a row before you physically have to go wash your hands, because you get buildup of all of the moisturizers and other chemicals that help stabilize the hand sanitizers. Soap and water has been around for a long time, and basically you're using both friction to help loosen up the viruses and bacteria and get them off the skin, as well as the soap itself helps bind and dislodge the abnormal particles or the possibly infecting particles on the skin. And so with that mechanism, it helps bind and helps be able to separate from the skin. A lot of the bacteria and such, they stick really well to the skin. So using a physical mechanism to rub it off, and then using a chemical mechanism to help absorb and gently pull off from the skin, works really well. The other important thing that I really try to emphasize to my patients, you do not need to have an antibacterial soap. In fact, we found that most of the antibiotics or antibacterial products that they're using in soap create resistance. And so we found that just washing your hands with general soap and water and getting good suds and making sure you're spending enough time does just as well of a job as a soap that has an antibacterial product. So I recommend actually not using antibacterial soap for the general use of washing your hands.
Well, and also just in terms of, I know a lot of people complain, oh, I've got a cold, please give me some antibiotics to clear this up. And obviously an antibacterial agent is not going to have any effect per se on a virus at all in terms of killing the organism, correct?
That is correct. Some of the reasons why we find benefit with using some of the antibiotics, the common one, I'm sure you've heard of, the Z-Pak or azithromycin,
right,
has really good penetration into the lungs, and it does help us with a lot of bacterial infections. However, it's been used so much that we've actually had certain recommendations by the CDC saying that the resistance to that antibiotic is so great, they're not even recommending it for certain infections.
Wow.
Oftentimes, our body is going to be the best neutralizer of these infections, and when someone develops, let's say a viral bronchitis versus potentially a bacterial bronchitis, you can't necessarily tell the difference between the two for the first or even second week. If it's viral, the antibiotic's not going to do anything. But you may not have known, the Z-Pak actually does help reduce some of the inflammation in the lungs, which is why some people seemingly get a benefit from taking it when they have a viral infection. That has created this perception that Z-Paks are great for anything that's causing problems in the lungs. And because we had that perception and it was being used so much, now we're finding that it doesn't work all the time when we need it to.
Well, and I think another, and that kind of segues into another misconception that's out there that has just consternated me as well as a lot of other people, is that you hear everything from pundits on TV to, hey, I just spent 5 minutes on YouTube, I'm now an expert on COVID-19. Basically state this is really no different than getting the flu. Everyone is making a big deal out of this, but it's really no worse than getting the flu. So other than probably driving anyone with a medical degree crazy hearing that, can you explain why that is such in this particular case with COVID-19, why that's such a dangerous misconception that people hold?
It's a terrible misconception, and there's multiple ways that I can really attack this question. First off, the influenza virus is not as, while it's very infectious and can spread pretty easily, the coronavirus or the COVID-19 that we're dealing with specifically is even more virulent, which means it's even easier to spread. And so all it takes is about one person with the COVID-19 to be sick and be around someone without protections or around a group of people, and very easily they have the ability to infect, maybe out of a group of 100, maybe 18 people around them. And if everybody else has those same chances, it's a lot more, serious for how quick the spread is going to be. With influenza, we actually have patterns to help predict the kind of virus subtype that we're going to see. It's never 100% because these viruses mutate as they spread from person to person. The size of the actual coronavirus compared to the size of the influenza virus is much greater. These viruses, they kind of are like carjackers, which is a good way to think of it. They just want to jump in your car and they want to drive around and get their job done, which is to replicate. The bigger the viruses are, the more potential there is that when they are making copies of themselves, that they're going to be sloppy, so to speak, and they're not going to really make sure that their genetic code is exactly the same. What happens when the genetic code changes? Well, they make different, bubbles, so to speak, protein capsules that they float around in, and that has a whole difference in terms of, who does it infect and what cells does it go after. So tiny, tiny little changes or errors can replicate and make it terribly difficult. Same thing that we've seen, for example, with HIV, way back from when it started becoming an epidemic in the US back in the 80s. The virus, it's another one that replicates quickly and it's sloppy. So the sloppier the viruses are in terms of how exact they copy themselves, the harder it is to make sure that we still have active treatments that will fight the viruses and or vaccines that will help us protect against it. Unfortunately, we've been looking at vaccines for HIV, gosh, since the 80s, since it came out, and we still do not have a vaccine today. That's why what we're trying to do is monumental. We're trying to come up with a vaccine to help protect individuals against the virus in months, when typically it takes years of research and testing to really find something successful.
Well, and that's very terrifying to contemplate. So thank you for putting everyone at ease.
You're so welcome.
Now, in terms of, again, sort of talking in current events with, what's been going on with the wide-scale protests that have been going on, in the country so far. So how is the medical community looking at this? Is the medical community looking at this going, we are in deep, deep, deep trouble coming up? Or do you think that people have been, better, I guess, sort of equipped to prevent the spread as a part of the different protests that have been going on?
Well, we certainly hope that the population is better suited to keep themselves safe, with wearing the masks as we're wearing right now, washing our hands. And that social distance is the other major key that has made such a huge impact in terms of what we've seen in the country. I really predicted that it was going to be two ways when this came out and all of the measures we were going to see. Either we were going to have massive waves of infection very quickly, unfortunately like what we saw in New York City, where the death rate and the illness rate was so great that our health system could not keep up with it. Or we were going to do so extremely well with all of our measures that we were going to have such a subdued response and low infection rate that people were actually going to stop believing that this was a real threat. I'm happy to say that in our region of the country, and a lot of regions of the country, early on, we've seen that. The extreme measures that we took were so incredibly important, and they've helped slow that curve, so to speak, which doesn't mean that we're going to necessarily see less infections. It just means that we're going to see lower numbers at one time, which really allows us to help provide in primary care, in specialized care, in the hospital care, provide the supportive services we need for patients to help them survive the infection. with these protests, unfortunately, all of the months that we've worked really hard to stay isolated from each other in order to slow down that spread, that's all been reversed.
Mm-hmm.
And while the protests, in my opinion, are important
Mm-hmm.
and have
Yep.
significant value, I mean, it's almost a different type of, pandemic, with discrimination that we deal with all across the world. Unfortunately, that has impacted how we're now trying to protect ourselves against, this infectious pandemic. So we have hotspots or areas where the infection rates are actually picking up quite a bit, scattered across the country. And I think that we've unfortunately seen some of these areas potentially expand. The tricky thing about the coronavirus is not everybody shows severe symptoms. And when the incubation time, so the time it takes for the virus to have enough copies in your body to actually show symptoms, anywhere from 10 to 14 days, we may still have to wait another week or two before we start to see the cumulative effect of all the people coming together during the protests.
Mm-hmm. It's just going to add more tragedy on top of tragedy, in
Mm-hmm.
a way. Now, in terms of the lessons learned, because there's talk that things may calm down potentially. I mean, I think this was put forward prior to the protests that have been going on, that there might be a lull during the summer and maybe early fall, but when winter hits and flu season hits, that we could wind up seeing a resurgence of COVID-19 in addition to active flu season. Basically, in this case, what can we do to prepare for this? Is there really anything that we can do, or other than just we're going to have to go through it again?
We're tackling that on different fronts. We do have at least 15 different vaccines, in testing phases to see if we can get on top of that. And that's kind of the biggest thing that we, in the scientific community and the research community can physically change the amount of infections that we're going to see. In terms of resurgence, going back to the discussion that we just had about the protests, I'm kind of curious to see if we're going to see this resurgence a little bit earlier than what we expected. We have lower rates of influenza, for example, during the summertime because people are outdoors more often. They tend to be around each other a lot less often. We have more air circulation, so the houses will typically get a little bit more fresh air in case somebody is sick to clear that out. If we have something that's a lot more virulent than the flu, so COVID-19 is much easier to spread, and then we're having these massive protests where, yes, I see people wearing masks, which is excellent because that's one of our major public health interventions, but we have a lot of close contact. And I doubt everybody is washing their hands and hand sanitizing every 3 seconds,
Mm-hmm.
that they're touching something, which again, just based on that situation, you can't perform all the preventative measures. So if we do see a resurgence, the hope is that all of the lessons that we've taken from wearing masks, washing your hands, monitoring symptoms. If someone's curious about symptoms and they call into the office, and they want guidance, the most important thing is checking your fever on a regular, checking your temperature on a regular basis to see if there are fevers, monitor your symptoms, and if you have them, definitely that's a sign where you need to self-quarantine. If you're not around other people, you can't spread the virus. And if you can get on top of the virus and have your immune system defeat it over time, and potentially you won't be infective or infectious anymore, and it'll be okay to be around other people again.
Oh, so fun stuff coming down the pike potentially.
Again, you're welcome.
Exactly. Thank you so much.
It's still important not to lose hope, though.
Right.
We have lived through awful pandemics before. Think about where our medicine was at 100 years ago, over 100 years ago, the 1918 influenza pandemic that we had, where we lost I believe it was over 1 million people when it was all said and done. And then fast forward 102 years and look at the technology and the research and the understanding we have. I think that we have the potential to do so much better than that. The problem that a lot of us are seeing in the healthcare fields, there's this distrust of science and distrust of medicine. And I'm not exactly sure where it's come from. I'm sure there are really challenging culminating effects, but my duty as a physician, as a healthcare provider, is to be honest with my patients and to do what I can to help guide and protect them. That's my job. That's my whole purpose. I don't benefit from lying. I don't benefit from bending the truth. Because my goal as a family physician, my philosophy is I want to help people have the highest quality of life they can and really fulfill what they want to fulfill. Mm-hmm. The thought of people thinking that we're not telling the truth, we're making this stuff up for other gains, it's sad and it's actually hurtful. Mm-hmm. It's really emotionally challenging for so many providers. There's been articles after articles where a lot of the docs and the physician burnout that we see, it is so amplified when people think that we're just pulling this stuff out of thin air. Mm-hmm. The whole point of science is to try to make reasonable decisions and about how things are and their existence that has evidence. Mm-hmm. I can say, well, I think the sky's purple. That's great that I think that. Can I prove it? Yeah, well, the problem is some people are now looking at belief as, well, I don't need to prove it. That's just what I believe. Mm-hmm, right. And people are entitled to their beliefs. But then we start running into these challenges. The hope is that people have enough trust in their physicians and the healthcare systems, in the health providers when we're sharing this information, when I'm spending time on my weekend, on my time off to come talk about this stuff. It's because we're really passionate about being honest and protecting people. Mm-hmm. And that's one of the biggest messages that I hope to share.
Excellent. All right, well, let's pause right there and we'll be right back.
Hi, everyone, I'm Colin Richards and this is Spare Change. This first one's Line Up and Get Out. And I got my
Well, thank you, Dr. Block, for being here and for answering those questions. And it's because this is so important, we've decided to actually make this particular show a 2-episode show, just because a lot of the questions that I'm bringing up, I think are important for the general public to know. And as they say, knowledge is power, and the more knowledge that's out there, the better, as far as I'm concerned. So stick around, and part 2 of our episode will be showing next week.